let's talk about seizure emergencies. What do you do if you see someone seizing in front of you? How do you help them? How do you make sure that you keep them safe? What are the things that you need to watch out for? A seizure is basically an electrical malfunction of the brain. It can be caused by several different things. Most commonly, it can be caused by an underlying medical condition such as epilepsy or other types of neurological disorders. And sometimes seizures can be triggered by certain medications, stress, lack of sleep, substance use or withdrawal from substances. Seizures themselves come in all different shapes and forms. Some people may just have a small twitch of their eye or a small kind of jerking movement. Other people may have what we call a grand mal seizure, where there's a generalized tonic-clonic seizure where they will have full-body convulsions. They will lose consciousness. They will stop breathing. So there's a whole range of different seizures. But the most important thing to remember with any type of seizure is that it's going to be very brief. So most seizures will last anywhere from a few seconds to maybe up to a minute or so. But generally speaking, they're not going to last longer than that. However, there are some exceptions to this rule. Certain types of seizures, especially absence seizures, which are also known as petit mal seizures, can actually go on for several minutes. And during those times, the person will look like they're staring off into space and they will not respond to anything going on around them. So that can be another reason why you want to seek emergency care. If it looks like the person's having a seizure and they're not stopping after a minute or two, then definitely get some help. Okay, so let's talk about what you should do if you see somebody having a seizure. First things first, stay calm. I know it can be really scary if you see somebody having a seizure, especially if it's your first time seeing it. But the most important thing is to try to remain calm and assess the situation and figure out what is going on and how best to help this person. So first things first, make sure that you are safe. So if you're driving, pull over to the side of the road. If you're outside, move away from any potential dangers such as traffic or falling objects. The last thing you want to do is put yourself at risk while you're trying to help someone else. Once you've done that, the next thing you want to do is check the scene to see if there's anybody else around. If you see anybody else coming, warn them about what's going on and ask them if they can call 911 for you. Now, depending on where you are, you may want to get an AED or automated external defibrillator. If you're in a public place like an airport or a mall, there may be an AED nearby. If not, that's okay. You don't necessarily need one, but it can be helpful in case the seizure lasts a long time and the person doesn't regain consciousness. Now, once you've done that, you want to gently approach the person who's having a seizure. Don't startle them or make them feel scared, because that could make the seizure last longer. Try to speak to them in a calm voice and tell them what's going on. If they're able to respond and they're oriented, then ask them what they need. Maybe they need some water, or maybe they need help getting home. But if they're not responsive or if they're still having the seizure, then you need to take further action. During the seizure, you want to protect their head and make sure they don't hurt themselves. So move any objects that could potentially be dangerous away from them. So if there's a coffee cup on a table next to them, you want to make sure that you pick that up. If they're outside, you want to make sure that they're not near any cars or any traffic where they could get injured. And if necessary, you may want to move them to a safer location. So if you're in a park and there's trees all around, you may want to move them to a clearing where there's less things around them that they could potentially hit their head on. If the person stops seizing, then you want to turn them on their side and monitor their breathing. If they're still breathing normally, then continue to check on them every now and then and make sure that they're okay. But if they stop breathing, then you want to begin rescue breathing immediately. So blow into their mouth, turn their head to the side, see if they spit anything out. Continue to monitor their breathing and just make sure that they're okay. And if they have a pulse, then make sure that you call 911 or get some help. Now, if the person continues to seize, then you want to continue to protect their head and make sure that they're safe. And if they're still seizing after 5 minutes, then you want to start chest compressions. Again, call 911 and start doing 30 chest compressions followed by 2 rescue breaths. And just continue that cycle until help gets there. Another thing you can do during the seizure is to try to help the person stop biting their tongue or eating their tongue. Because the tongue has a lot of blood vessels in it, they can easily bite down on their tongue and start bleeding profusely. So if you can, try to put something in their mouth that's soft, something like a piece of cloth or even like a tennis shoe or something like that. Just try to put something in their mouth that will prevent them from biting down on their tongue. Now, there are a couple things you don't want to do during a seizure. First thing is, you don't want to restrain the person or hold them down. Even though you may think that this would be helpful, it can actually be very dangerous for the person having the seizure. it can increase the likelihood of them injuring themselves. And it can also cause something called status epilepticus, which is when the seizure lasts for a really long time. And that can be life-threatening. So you never want to try to restrain somebody who's having a seizure. The other thing you don't want to do is put anything in their mouth unless it's an emergency. Like I said before, you don't want to put anything in somebody's mouth because they could end up biting down on it and they could injure themselves. So only put something in their mouth if it's an emergency, like if they're biting down on their tongue and you need to prevent them from swallowing their tongue. And finally, the last thing you don't want to do is leave the person alone. You always want to stay with the person until help gets there. Even if the seizure ends and they seem to be okay, you still want to stay with them and monitor them just in case they have a second seizure, or if they start vomiting, or if they have trouble breathing. You want to be there in case they need some assistance. Okay, so let's talk about what happens after the seizure. After the seizure, you want to make sure that you stay with the person and monitor them closely. They may be confused or disoriented. So you want to make sure that they're okay and that they know where they are and what's going on around them. You may also want to ask them if they have any injuries. So check to see if they have any cuts or any bruises. And if they do, you may want to apply first aid and clean those wounds up. Another thing you want to do is make sure that they have their medication if they have any. So if they're on some sort of seizure medication, make sure that they have it with them and that they take it if they need to. If they don't have it with them, or if you're not sure if they have it with them, then you want to wait until emergency medical services gets there and they can transport them to the hospital. If the person seems to be okay and they're alert and oriented and they have their medication with them and they can take it, then you can help them get home. But if they're not okay, or if you're not sure, then you want to wait until EMS gets there and transports them to the hospital. So hopefully this was helpful. Hopefully now you know what to do. If you see somebody having a seizure, just remember, stay calm. Make sure the person is safe. Move them to a safe location if necessary. Turn them on their side if they stop breathing. Start rescue breathing. Protect their head. Start chest compressions if they're still seizing after 5 minutes, and stay with them until help gets there.